Commissioner Hughes provided us with 62 recommendations to guide us in building an improved system that would tackle the root causes of family breakdown and create better future for children. Last year, we began work on 31 of these recommendations. I can tell you today that work is in progress on 26 of these recommendations. And I can report that the Social Work Professional Act will be in effect this April, that there is a national working group to address the number of Aboriginal children in care, and improved training initiatives are underway. And today we are announcing that we will establish a revised funding model for CFS agencies that will allow for 60% increase to in-home family supports. Funding changes will create opportunity for greater flexibility in dealing with family size, complexity of needs, and geographical location. We will build the capacity of community agencies to offer more services for families earlier, to help prevent families falling into crisis. We will immediately hire an Indigenous Associate Deputy Advocate to work on behalf of Aboriginal families and children, ensuring they are treated fairly in all dealings with the CFS system. We will create a pilot project called Circle of Care, based at Saugeen First Nation, that will assist families in working their way through difficult issues while respecting cultural needs and by focusing on the families first, rather than the system. The child welfare system must be a response to a much larger issue that affects the fastest growing population in our province. The Canadian legacy of colonialism, with residential school policies being implemented over multiple generations, the 60s scoop compounded with historic and present-day racism since the signing of treaties, has resulted in very sad and unfortunate outcomes for the Aboriginal population. Poverty is one of the largest negative outcomes for Aboriginal people, and along with our Aboriginal partners, our government is committed to addressing the causes of poverty through supporting economic development, creating employment opportunities, along with better education and supports for families. The Office of the Children's Advocate has done exceptional work supporting children and families in the province of Manitoba. But what this acknowledges is that 87% of children in care are of Aboriginal descent. And there needs to be, we believe, a person within that agency that will provide them with some guidance around cultural awareness, that will provide them with some support around engaging Aboriginal leadership. So the caseloads are, we do an average, and so we use our technical, our CFS system to give us that information. So it's around 1 in 28.
They're at about 28 right now?
Yeah. Yeah. But you have to always, sometimes with the changes within an agency, if a person is leaving, sometimes they're taking on extra cases. So, and hopefully that's very, very temporary until they hire another staff person.
Is that one of the big recommendations, though, that you're working on? Because isn't it supposed to go down to 20?
Yes, that's one of the recommendations, or an option for action is 1 to 20. Yeah.
Do you accept that still, or is that something that you're also comfortable, that you may not quite reach with?
Well, we have right now what we have is 1 in 25 is what our caseload ratio is. So we will be seriously looking at that, but we need to make sure that we are continuing to provide family enhancement or family prevention services to families while we're doing that. So we'll be working to review that recommendation.
So that's another one that might not be feasible?
Well, it's about developing your workforce, and it's also about making sure that you have the appropriate training and support for the staff. In this report that we've received today, there is a really interesting option about an apprenticeship program, which it still is really very much on the initial stages. We have a lot of work around to see how we can implement it, but we're very seriously looking at what does an apprenticeship program look like? How does it support the frontline staff? It would have to be a phased-in approach because you need to develop your workforce, And you also need to ensure that you're providing them with the ongoing training. And also to bring that down, there's also a financial cost to that as well. But if we are able to work on reducing the number of kids in care, there will naturally be a reduction, right? So I think it's really a balanced approach that we're looking for. And I wish there was one way. There was a magic bullet, but there isn't. It's all of us kind of working together, cooperating, sharing ideas, and moving forward. And I hope that people feel optimism that we can do this, because I do. When I read this report, that was my first reaction is there's a way forward and we can do this together.